This is Jon Lascher from Partners in Health Sierra Leone. Today is Friday, May 1st. It's International Labor Day, a holiday here in Sierra Leone. But we are joined today by Musa Bangura, our lab manager for Partners in Health, and he normally works in Kono. But before we dive in with Musa, I just wanted to update everyone that there were 12 new cases today confirmed in the country, bringing the total number of cases up to 136. And I know by now everyone has heard that there's going to be a national lockdown for 3 days starting on Sunday. So Sunday, Monday, and Tuesday. So we'll have more information about that in the coming days. But for now, I want to jump in with Musa. Musa, how are you doing?
Fine, John. How are you?
I'm doing well too, thanks. So Musa, can you introduce yourself to those who might be listening and don't know who you are?
Yeah, thank you very much. My name is Musa Bangura. I work for Partners in Health. I am the laboratory manager.
How long have you been working for PIH?
Yeah, it's over 4 years now. I'm going to be 5 years by October.
Tell us a little bit about your job, what you do in Kono before coronavirus.
Yeah, so before coronavirus, my job is to ensure we support the Ministry of Health in health system strengthening in the context of lab services. We want to provide advanced and quality laboratory services. Currently, we are doing it at Koidu Government Hospital and Wellbody. We are also providing some support at Laka and even Kisi as well. So basically, this is what we are doing at Sierra Leone and specifically at Koidu Government Hospital. Yeah.
Do you have a nickname at PIH?
Yes, my popular name is Quality. Everybody know me as Quality. Yeah.
And you're called Quality because of your expertise in lab, or are there other reasons too?
Yeah, it's because of my expertise in labs, because I'm very much concerned about the quality of job people do at PIH, especially labs. I'm very much meticulous in the results that we normally send out to clinicians. So I got that name as a result of the first appointment I got at PIH. I entered PIH as a lab quality officer. So the work I do during that time when I was lab quality officer was very much awesome. So everybody called me Quality, yeah.
Can you talk a little bit about what the lab was like 4 years ago when you joined PIH, or what the lab program was like 4 years ago, and sort of what has changed and what the lab is like today?
Yeah, so from 2014 when PIH came to Kono, Koidu Government Hospital as a whole, the lab in specific, was a no-go area. No-go area in the sense nothing was happening in the lab. There were no reagents, no test kits, no equipment, no nothing. Everything was done manual. It was only like stool, urine, just the basics that can be done at a primary healthcare facility, you know. So, but when we came, because part of our mission is to ensure we strengthen health system in the country, and that includes lab services, quality lab services, you know. So we decided to support Koidu Government Hospital Lab. We went there, we tried to, first of all, arrange all the workflow. We bring in more equipment. PIH bought in the human 3000. We bring in a Sysmex hematology analyzer. We train the staffs. We make sure we rearrange the workflow. You know, we equip the lab. If infrastructural-wise, we expand workflows, you know, and all that. So basically, just to sum up, this is what we've been doing, and up to now it's happening, yeah.
Have you worked in other labs and public hospitals in Sierra Leone?
Yes, virtually I've worked in all 14 districts in this country, starting from Laka, the Central Public Health Reference Lab in Freetown, to Obo Government Hospital, to Connaught, to Cottage, to McKinney. All over the country I've been around working.
And how does the lab at Koidu Government Hospital compare to the labs at some of the other referral hospitals in the government system? Yeah,
so basically, I was once an MOHS person that was working with labs. MOHS is Ministry of Health and Sanitation before I joined PIH. So, we work in an MOHS facility, but I will tell you there are very huge difference. One, I will look at supply chain. You know, the MOHS lab or other ministry labs are very much under-resourced with regards to supply chain. And one thing, when you want to strengthen lab services, your supply chain systems has to be very strong. You should not be stuck out of reagent, so that service interruption will not be, something that is, the lab can all the time say, hey, we don't have this kind of services. We don't have this because of lack of reagent. So the difference now, when you come to Kwedu Government Hospital, we have expanded the lab in such a way that our test menu is so huge, so that we can able to meet to the demand of the clinicians that we are getting. Now we have all sorts of expertise at KGH. We have an OBGYN, an internal medicine specialist, a pediatrician, all this other specialty, infectious disease. So the lab has grown to meet to the demand to this kind of clinical specialty. We are also doing blood banking as well. That also has been expanded a lot. Yeah.
Can you talk about why blood banking would be so important?
Very, very important, because part of our mission also is to ensure we save the lives of women that are coming to our facility to give birth. When you look at the epidemiology of maternal death across the world, you will find out that Sierra Leone is one of the high-risk areas where women will die as a result of them giving birth. So PIH thought it wise to ensure, to cut down some of these figures, we decided to support the blood bank big time. So it is deliberate from our side to ensure we put the blood bank in the maternity complex, so that women that are coming to give birth, they will have access to this free blood. So that's why PIH has supported the blood bank, and we are doing 2 blood drives per month, and we are getting blood. We are doing family replacement. We are supporting them with reagent and consumables, blood bags, and we are training the staff to ensure they do the right thing. Yeah.
So there's been a lot of talk now around lab because of coronavirus. Can you just talk a little bit about why is it so difficult right now to guarantee lab testing for coronavirus?
Yeah, it's so difficult because you're looking at what is happening across the world right now. Supply chain system has been so stiff. Planes are not coming in to bring in reagents, even the normal lab work. Now, corona testing is something very much different from what the normal lab is doing. Corona testing, for this country, we are using a real-time PCR test, which is a molecular test, need high skills of technicians to operate some of those platforms. So for this country, we only have 4 labs that can do that. The LACA lab, the UAP3 lab, Connaught Hospital, and Kenema. Yeah, so basically, these are the only 4 locations where you can have a real-time PCR to do testing. So it's very difficult, even here in Freetown, looking at the cases we are getting. So it's very tough for the lab to able to meet to the demand because of shortage of this reagent. It's very difficult to get them. You have to ship them from abroad, yeah.
So what happens now if someone comes into Kono? So what happens if someone comes to Kwedu Government Hospital showing the signs and symptoms of coronavirus right now?
So basically, from a lab perspective, we've trained the lab techs at Kwedu Government Hospital to do what we call COVID-19 specimen collection. They have the required skills. I know the clinical team, Vicky, and the rest of the team members have also been trained to do proper isolation. Our role there is to ensure we do proper specimen collection. We triple package it and send it to a testing site. And our closest testing site is Kenema Government Hospital, which is like a 2 hours drive from Kwedu. Yeah.
How long does it take from the moment a specimen collector takes the swab? How long will it take to get a result?
So basically, that's what we call the turnaround time, the time from which the specimen is collected to the time the result is coming. For now, Sierra Leone, we are looking at a 24-hour. Within 24 hours, you can get the result. Yeah.
And right now, do you know how many tests are available in Sierra Leone?
So currently, I don't have the figures right now, but I know we do not have much tests as I'm speaking currently, though I was told at the EOC meeting sometime last week that we received some few supplies from Jack Ma Alibaba Foundation from China. We actually don't know the quantity of those test kits, and we don't even know what is there. We are only told we have assorted medical supplies, including laboratory supplies. So for now, I actually don't know the exact figures that are there. But all I can say, we don't have enough tests looking at the current trends that are happening, how the cases are coming up, yeah.
So are there other types of tests besides PCR tests? Why is it just this PCR test that is being used?
Yeah, so part of the support PIH is given to the lab pillar at the Emergency Operations Center here in Freetown is to ensure we support them also in expanding the test capacity so that we can able to reach to the demand of COVID-19 patients that are coming up. So my role at the EOC right now is to ensure we are able to talk to the leaders there to see what are the needs so that we can come in where possible, as things are coming up. So beside PCR testing, we are envisioning to have COVID-19 gene expert cartridges. So from a PIH perspective, we are trying to talk to the Boston team together with Jon, the executive director, to ensure we have these COVID-19 cartridges here. But the problem with those cartridges is because up to this time as I'm speaking, the manufacturers are still planning to ensure we have them on the market. So they were saying we'll not get them till June, July, and we still don't have them in the market. So currently what is happening is real-time PCR testing.
If you could predict, what do you think will happen around lab testing and coronavirus over the next kind of 3 to 6 months?
So basically, looking at what is currently happening, especially here in Freetown, people are not practicing proper hygiene, social distancing is very more difficult. Epidemiologists actually are predicting, including myself, are predicting that we are going to get more tests coming up in the next few weeks or even months with regards to coronavirus. We are getting more cases. Of course, you can see the figures that are coming up, and now we have a lot of isolation and quarantine centers across the country. So we are going to get more tests for COVID-19. But currently, we still have the real-time PCR. We are praying that in the not-too-distant future, we get the gene expert cartridges for COVID-19 because that's what we use during the Ebola. These are the type of platform we use during the Ebola. For Gene Expert, it's like 2 hours the turnaround time, you have your results. So that's why we are praying that we have the Gene Expert cartridges, yeah.
And is it safer? I mean, can it be done? Can you only do that Gene Expert test at the 4 national labs, or can you do it at other places in the country?
So Gene Expert is all over the country. Yeah, the National TB program has distributed Gene Expert machine in all the 12 or 14 districts in Sierra Leone. So Gene Expert is like a point of care test. Even in Kono district, we have 2 Gene Expert machines. So it's to our advantage if we have the cartridges to be doing the Gene Expert cartridge and the test for COVID-19.
I remember during the Ebola outbreak, to be a lab specimen collector or to be analyzing laboratory tests as a technician was very dangerous. Is that true during the coronavirus outbreak as well?
Yes, it's very true because these are the same viruses that we are playing with. The lab is a unique place wherein we have what we call standard operating procedures. All our SOPs should be obeyed. All our IPC protocols should be obeyed. The lab continues to be a dangerous place to go if you are not a lab person because we are playing with dangerous viruses. You can get yourself infected easily if care is not taken. That's why not everybody is allowed to enter a lab wherein we are analyzing some of these highly infectious substances. It's the same risk level. They are similar viruses. The transmission route, some of them are almost the same. Though COVID is different from Ebola. Yeah, but the same risk level.
Can you just talk briefly about sort of the national response and you coming from Kono to Freetown and what you've been doing on sort of a day-to-day basis in Freetown?
Yeah. So basically, my job is to ensure, here in Freetown, is to ensure I support the lab pillar at the EOC. EOC is the Emergency Operations Center at Wilkinson Road. There you have all the government people that are deciding as to how this response is going. So I was invited by the executive director to come down to Freetown to ensure we provide technical support, advice, and listen to the needs when they are coming up in those meetings so that we can see how we can do, if possible, to address some of those needs. And we also want to help them to expand their testing capacity because as things are coming up right now, we're expecting more people to be tested in the next 2 distant future. So I'm here to ensure we have a conversation over that together with the lab pillar leads, together with the senior ministry people to ensure we discuss possibilities of expanding the testing sites and the testing capacity of the country. I'm also in conversation with them to ensure we have like a testing site in Kono, because what we've discovered, you have a corona patient in Kono. The time you collected the sample, take it to Kenema, the 24 hours turnaround time will be, overdue. So if we can able to talk to the ministry people, they give us the go-ahead, then we can set up a testing site also in Kono.
Great, thanks. What's keeping you motivated right now?
Thank you very much. This question, it's one of my favorite questions because I always keep on what I'm doing at PIH because of the outcomes that I'm getting. In previous areas where we work, you will go do your work, but you will not see the outcome. For PI, the outcomes are real. It's what we call real time. You can see it. You do it now, you see it now. So that's what is keeping me going. And I have colleagues that I admire. Senior colleagues, colleagues that are working with me, junior colleagues that inspire me a lot, within the organization. So basically, that's it.
Thank you so much, Musa.
Thank you, John. You take care.
You too. Stay safe.
Yeah, thank you.